Trump administration says there is a link between acetaminophen and autism.
They claim the active ingredient may not be safe for pregnant women, but state health officials say science doesn't back up that claim. News 9's Jordan Frumstead is here to share their advice for parents.
Well, guys, a lot of confusion over this recommendation. One of the state's medical leaders says this recommendation could cause more harm. She says this announcement won't change their message to patients.
Don't take it.
On Monday, politicians in Washington told pregnant women to avoid acetaminophen.
Fight like hell not to take it.
The Trump administration cited some studies that suggested a potential association between the medication and autism.
The science just isn't there yet.
Dr. Julie Strebel is president-elect of the Oklahoma State Medical Association.
We are the best people to interpret that science.
As an OBGYN herself, Strebel says acetaminophen, known as Tylenol, helps mitigate pain and reduce fever.
Not treating fever or pain does have an adverse outcome.
Strebel says untreated pain and fever can cause brain inflammation in babies.
Some of those adverse outcomes are miscarriage.
In December, OU Health Dr. Susan Redwine said there is more awareness about autism.
Primary care physicians are more aware and screening more for autism.
Mercy Hospital OKC says it encourages patients to raise any questions with their physician so they can make safe, informed decisions about their health care.
Science is a living thing, and our recommendations do and will change in time.
Strebel says medical advice shouldn't be based on feelings.
This is based on what I feel.
We are following opinion that's not necessarily based in science.
She says politicians should proceed with caution.
Giving them information like this, I think, can be very dangerous.
And let doctors do their jobs.
That conversation just needs to remain in the doctor's office.
On another note, there have also been suggestions that vitamin B9 can help children with autism. Doctors have recommended this nutrient during pregnancy. Folic acid helps with spinal cord development and brain development. Strebel says there is some research that suggests this nutrient can help children with spectrum disorders.
But we're talking about a very small number of people, and those are genetically identified because we know by doing the studies who lacks those receptors.
And last week, the CDC committee voted to change its MMRV recommendations, recommending children under 4 should not get that vaccine. However, the American Academy of Pediatrics says people should disregard that change. Carl?
All right, Jordan, thank you. And the CDC was also set to vote to change the schedule for the hepatitis B vaccine, but that was tabled for a later date.